Welcome to the show. I'm Kathy Ireland. In the healthcare industry, safety and healthcare compliance regulations are more than just guidelines. They're the law, and they keep us safe. Today, we're joined by MedSafe CEO and co-founder Christine Foisey, Vice President and Senior Customer Care Advisor Julie Cementa, and compliance professional Mandy Martin to see how their company's approach to turnkey regulatory compliance programs has quickly become the industry standard. Welcome, everyone.
Thank you, Kathy.
Now, Christine, what is MedSafe?
MedSafe is a regulatory healthcare compliance company. We go into different offices, medical, dental, funeral home, and even veterinary hospitals, and we show them what they need to do to become compliant.
And what were some of the challenges that you saw in the industry that inspired you to launch MedSafe?
So back in the 90s, when we started, we saw that in the dental fields that there was not enough knowledge and not enough education for the doctors to follow the rules and regulations of the federal and the state laws. So then we started to expand from there and went into the other industries.
And Christine, can you walk us through some of the core solutions and services that MedSafe offers customers?
Sure. We offer OSHA, HIPAA, corporate compliance, and other online training courses. We do on-site, where we'll come in and assess the office. We'll come to you with a report of recommendations on how you can fix those inconsistencies so that you are in guidelines with the government regulations.
And Mandy, as one of MedSafe's compliance professionals, you're probably in the best space to talk about your company's compliance programs. Can you give us an overview of how these initiatives work?
Absolutely. There's 7 elements to having a complete compliance program.
Okay.
So you have to look at where you're going and what you're doing, and each office is different. So we have 7 elements. So you have your education and training, which is vital to any office. You need to educate and train your staff on a yearly basis. When you don't tell your staff what your policy and procedures are according to the practice you're running, there's an empty space, and that's when you get the I don't know. Monitoring and auditing needs to be done internally. Most things can be found when there's an error, and you can do that internally to correct that so you don't end up with more issues or problems that can cause fines. We want to make sure that people understand the enforcements that go with it. Enforcing the standards in the practice, then you can avoid any other disciplinary problems that may come forth. We also have reporting, as the saying goes. If it wasn't reported and it's not documented, it never happened, and we have to understand that. And of course, we want to make sure that any and all compliance issues are taken care of. And with that, you should assign someone in your office to be their compliance officer. Or if you have a large company, you should have a compliance committee.
Right. And Mandy, once you help customers put those steps into place so that they have a proper, well-formulated compliance program, how do you keep track of issues and oversee future actions like employee training?
We are in constant contact with our clients. And we have a saying in our office that says, compliance never sleeps. Because there's a lot of practices that are open 24/7.
Right.
Urgent care centers, medical facilities. We have to look at those things. So we give our clients the proper tools to use so they can address any issues that were in the past and correct any issues that may be current at that time. And they can come to us for that. We are their resource.
Right. And Mandy, who do you see as the ideal MedSafe client?
Well, we want the ideal client to be the ones that are already compliant when we walk into the facility, but that doesn't happen. Generally, the clients that don't understand they need a compliance team have already felt the effects of fines and penalties. Then they're not sure what to do. So they reach out to us, and we can help them understand the pieces of the puzzle that need to be put in place so they are compliant. We provide every client of ours, no matter what industry, medical facilities, dental facilities, veterinarian practices, or funeral home industries. We provide them all with a written exposure control program. When you start to have injuries in your practice, you want to be able to have that go-to policy and procedures So then you can assess and address and correct.
Excellent. And Julie, what makes you most proud about this work?
It's our customized hands-on approach that our customers are not just an account number to us. We really want to make sure that their offices are in compliance.
Right.
We assess where they are in their facility. Do they need more help? Do they need us to really spend more time with them? Or do they just need us to come out annually and answer questions throughout the year? It's really how we customize each program to our client.
Julie, in a crowded industry where customers could easily tackle compliance on their own or go to a MedSafe competitor, what makes MedSafe the best choice?
It's our 20 years of experience, knowing our customers and knowing where they really need us, going on site, finding out where they might think they're doing very well, and we help them identify those areas where, well, you really need to pay more attention to this. So we always are touching base with them, making sure that they know we're always here to help them out and, make sure that they're in compliance and doing well.
Great. And now for the most important question, how can potential customers get started with MedSafe, or at least get a taste of your platforms and client offerings firsthand?
Sure. So it's very easy. Just go to medsafe.com or call 888-MedSafe, and we'll be more than happy to put you in touch with one of our compliance partners if you have specific issues you'd like to discuss, and then we can determine from there what programs will be best for you, and you can chat with our sales advisors.
Congratulations to
Thank
each of
you.
you, and thank you for joining us today.
Thank you
Thank
for
you.
having us.
Thank you. And thank you for watching. I'm Kathy Ireland.